Welcome back. The Philadelphia School District has unveiled its plan for the upcoming school year, and joining us live to talk about it is Superintendent Dr. William Hite. Dr. Hite, so good to have you here. Good morning.
Good morning. Great to be here.
And glad to have you. We're going to get right to it. You released this reopening plan yesterday, and it's a hybrid model. So there will be in-person and remote learning for students. Why did you think that this was the best way to go?
Yeah, I mean, so just as school districts have done across the country, us here in Philadelphia, we've had to devise a plan that reimagined school in a way that ensured children had some access to learning, both virtual and in person, and that we were protecting the safety of our students and our staff members. And so that's why we had to go to a hybrid plan. And it's in order to meet all of the guidelines, all of the safety guidelines, all of the sanitizing guidelines, the distancing guidelines. We had to reduce the number of days that children were in school so that we could get more young people, so we could have an opportunity to have more young people in the classrooms over a period of time.
And speaking of safety guidelines, what measures will be in place for students when they do head back to the classroom in the fall?
Yeah, so thank you for that question. So everyone, students and staff members, will all be required to wear a mask. And we're going to be providing masks for children. We're also going to be providing a cloth mask for our staff members. For younger children or children with complex needs where a mask may not be the most appropriate, we will have face shields as well. And we will be providing those for individuals. Naturally, people can wear their own, but we are going to be providing them. We're going to be utilizing strict distancing protocols, 6 feet apart. Students will grab their breakfasts, enjoy those in their classroom. We'll also have lunch in the classroom. But if we can't do that in some cases, they will have it in the cafeterias, but cafeterias will be set up to keep children 6 feet apart. All classrooms will have no more than 20 students in them at one time, and those desks will be organized they will be organized 6 feet apart. And we will also have screening protocols, and these are self-screening protocols that all staff members will do before entering the building. And we're asking families and students to inform us if they are sick, and if they are sick, we want them to stay home. Mm-hmm. But if not, if they've been around someone who has been in touch or in contact with someone who was COVID positive, we also need to know that information. And so we've been working with the commissioner, the health commissioner, with the city of Philadelphia, with PDE, and with national organizations, with the Children's Hospital here in Philadelphia and the Policy Lab. And we have devised this plan really taking into consideration all of the recommendations to maintain safety for staff and for students.
I can only imagine what a huge undertaking this is for all of you. You did mention at the very minimum, kids will be learning remotely some days during the week, and parents do have the option to keep their kids at home entirely if they so choose. But for teachers, though, it's been challenging for them. They were kind of thrown into this during the spring. What kind of additional training may they undergo so that they can be most effective when having to teach remotely?
Yeah, and thank you for the other 2 points about our schedule is one that has children coming in 2 days a week, either Monday and Wednesday or Thursday and Friday. And then on the other days, they will be digital. Our kindergarten students will be 4 days a week, and our special education students with complex needs will also be 4 days a week. And everyone will be digital on Fridays. And that is to ensure that we are recleaning the buildings in preparation for the following week. And there is, as you indicated, a virtual option that families may sign up for. If this schedule is too complex and is too difficult, or they do not feel comfortable sending their children back, we do have the ability for people to sign up for our digital academy. And the digital academy will all virtual at least through the first quarter of the school district and of the school year, excuse me. And so the teachers, to your point, teachers who are in the vulnerable categories and have medical reasons why they should not be in person teaching will also have the ability to teach in a digital academy. In addition, they've received a lot of training already, and we have pushed the start of the school year back slightly so that we will have 2 weeks, almost 10 days with teach when they return in the fall to actually train on this new model and on how to, it's really around some trauma training as well, because everybody has been traumatized by this pandemic, especially the children we serve, but many of the adults as well.
Absolutely. Well, Dr. William Hite, you know, it's, as I said, a big undertaking for you and for the teachers and for these families and students too. So wishing you the best of luck as you guys begin to prep for this upcoming school year. Thanks so much for joining us this morning.
Really do appreciate it. Thanks for having me.
All right. Thank you. In other